Human Metapneumovirus, the hidden respiratory threat you need to know about. Have you ever experienced a cold that seemed worse than usual? Or watched a loved one struggle with breathing issues that weren't COVID-19 or the flu? It might have been something you've barely heard of, Human Metapneumovirus, HMPV. This hidden respiratory threat affects millions globally, but remains largely under the radar. Today, we'll dive into what HMPV is, how it spreads, its symptoms, and how we can protect ourselves. Stay tuned. This vital information can make a difference for you and your community. HMPV, or Human Metapneumovirus, is a respiratory virus first discovered in 2001 but believed to have circulated for decades. It belongs to the Paramyxoviridae family, which also includes respiratory syncytial virus, RSV, another common respiratory virus. What's alarming is that HMPV doesn't discriminate. It can affect people of all ages. Though most cases are mild, the virus has a more severe impact on young children, older adults, and individuals with weakened immune systems. If left unchecked, severe infections can lead to complications, such as bronchitis or pneumonia. Understanding HMPV gives us the power to recognize and address it. With more awareness, we can limit its impact and safeguard the most vulnerable members of society. HMPV spreads in much the same way as the common cold or flu, via respiratory droplets. If someone carrying the virus sneezes or coughs near you, droplets containing the virus can enter your system. Similarly, touching a surface contaminated by the virus and then touching your face can lead to infection. What makes HMPV particularly tricky is how contagious it can be. The symptoms often mimic those of other respiratory illnesses, which hampers proper diagnosis and treatment. As a result, the virus can spread unknowingly, especially in crowded settings. This is why public awareness about HMPV is critical. Knowing how it spreads and taking precautions can significantly reduce its transmission in our communities. One of the first steps in combating HMPV is recognizing its symptoms. These can vary from mild to severe, including cough, runny or stuffy nose, fever, wheezing or difficulty breathing. In more serious cases, it can cause bronchitis or pneumonia, particularly in at-risk individuals, such as the elderly or children under 5. If symptoms worsen, a medical consultation becomes essential. To confirm an HMPV diagnosis, doctors may perform a PCR test or antigen detection using a nasal or throat swab. Identifying the infection early can help provide the right treatment plan and avoid complications. Currently, there's no specific antiviral medication available to treat HMPV. The good news is that most people recover with supportive care. This includes staying hydrated, getting plenty of rest, and using over-the-counter medications to manage symptoms like fever or congestion. However, severe cases may require hospitalization. For individuals with difficulty breathing or low oxygen levels, treatments such as supplemental oxygen therapy might be necessary. Although there's no targeted cure yet, proper care and attention to symptoms can make recovery smoother. In the absence of specific treatments, prevention becomes our strongest defense against HMPV. Here are simple yet effective measures to protect yourself and others. Wash your hands frequently with soap and water for at least 20 seconds. Avoid close contact with individuals showing signs of illness. Regularly disinfect surfaces that are commonly touched, such as doorknobs, phones, and counters. Practice respiratory etiquette by covering your mouth and nose with your elbow or a tissue when sneezing or coughing. Most importantly, stay home if you feel unwell to prevent spreading the virus. By adopting these habits, not only can we prevent HMPV, but we can also reduce the spread of other respiratory illnesses. Small actions can have a big impact on public health. It's natural to wonder whether HMPV could replace COVID-19 as a major health concern. The answer, however, is no. While HMPV poses significant risks, it isn't as severe or disruptive as COVID-19. That said, HMPV still deserves attention. Its impact on vulnerable populations and the healthcare system cannot be overlooked. Raising public awareness ensures that we don't underestimate its potential dangers. Understanding HMPV, along with other respiratory illnesses, equips us to respond effectively and protect public health. Human metapneumovirus might not be as well known as COVID-19 or the flu, but it's a virus we can't afford to ignore. By educating ourselves about its symptoms, transmission, and prevention strategies, we take an essential step toward minimizing its spread. Remember, staying informed isn't just about protecting yourselves, it's about safeguarding your families, friends, and communities. Together, we can reduce the impact of HMPV and improve public health outcomes. If you found this information valuable, don't forget to hit the like button and subscribe to our channel for more health insights. Have you encountered HMPV? Share your experiences in the comments. We'd love to hear from you. Thanks for watching and stay healthy.